Welcome everyone to the graduation ceremony of GRRSP15. This is a very special day for all of us, and actually even more special because of how close-knit and interesting this group has been over the last 6 months. This is not just about our scholars who are almost alumnus, but also about our faculty who are going to be celebrating and hearing your progress. So we'll be starting off with your presentations. That is going to be for about 7 minutes, and followed by Q&A by the faculty. And then, of course, part of the presentations is going to involve some guest speakers, some celebrations, some ceremonial formalities. So welcome again, and let's sort of start off with our first speaker for today's graduation, which is Dr. Usha Ravi, who is going to present her main project as part of these 6 months.
Thank you so much, Dr. Nawaz. Basically, my main project, especially in the past 6 to 7 months with GRRSP, has been use of biologics in pediatric asthma. And this was a scoping review. Are you guys able to see my screen just to make sure? Okay. As we all know, asthma is a chronic condition which causes inflammation of the airways. Due to the inflammation, what happens is like whenever we are breathing air out of the lungs, it's really harder for patients to do that, which causes wheezing and shortness of breath. And that's what is basically the definition of asthma. When we talk about prevalence, globally, 300 million people are affected by asthma. In the US alone, we see 25 million people who have asthma, of which 4.7 million are children. On an average, every single day, 9 people die of asthma. Because it's a chronic inflammatory condition, it cannot be completely cured, but it can be very effectively managed with proper treatment and proper diagnosis. Before I delve into the treatment, I just wanted to talk a little bit about how the groups or the severity of asthma is classified and how, based on that, the physicians or healthcare workers will decide which treatment suits which category. So the first classification is basically in four: intermittent, mild persistent, moderate persistent, severe persistent. For intermittent, as the name clearly suggests, intermittently the patient has symptoms less than 2 days a week and nighttime awakenings less than 2 days a month. Whereas mild persistent symptoms are a little bit more persistent, less than 2 days a week again, but not daily, but daily nighttime awakenings. Okay. Uh, at least 3 to 4 times per month. Uh, in moderate persistent, the patient will have symptoms more than one time per week, but not nightly. And almost every day they're going to wake up in the night, coughing or shortness of breath, needing to use the albuterol inhaler, which is the rescue medication. And severe persistent asthma is like every single day they have symptoms. There is restriction of activity, and they're just not able to function, just like other kids, just because of that restriction, unless properly managed. So based on this classification, most of the treatment of asthma is based on, and then we can divide it into short-term and long-term. Short-term asthma, we generally treat with like a rescue inhaler, like short-term beta agonists, oral corticosteroids, and short-acting anticholinergics. Whereas long-term asthma, we usually do maintenance treatment like inhaled corticosteroids, biologics, which is one of the biggest category of drugs that we were talking or focusing about, leukotriene modifiers, inhaled mast cell stabilizers, other long-acting bronchodilators, as well as allergy shots in some cases. So when we talk about biologics, it's basically all the monoclonal antibodies. And the first biologic to be approved in pediatric patients was really recently in 2016, and that was omalizumab. So that was a little bit about the background of asthma. Uh, when we did the scoping review, the objective of our study was to see if biologics really reduce asthma exacerbations or hospitalizations in pediatric patients with asthma. So what we did for that is we searched 5 different databases, PubMed, Scopus, Embase, Web of Science, EBSEO, and we like specified the timeline from 2019 to 2025. We put this particular search strategy in PubMed, and we got around 169 articles. In other databases combined, we got 293 articles, and total we got 462 articles. We set some inclusion and exclusion criteria to be able to include the studies, whatever we feel it's fitting this criteria. So age, obviously, pediatric populations, birth to 18 years was one of the big inclusion criteria. Patients with a diagnosis of asthma or reactive airway disease, anybody who is under the age of 5 um, and has asthma-like presentation cannot be diagnosed with asthma, and we call them reactive airway disease. Patients who are on these particular medications, which we chose from the biologics category, studies looking at reducing asthma exacerbations or hospital admissions. Exclusion criteria was studies with patients greater than 18 years of age. Obviously, adult population we excluded because biologics are also used in other diseases or conditions like urticaria, atopic dermatitis. We tried to exclude those studies, and obviously we excluded the studies which are not available in English.
Sorry to cut
Uh,
you, Usha. Could you go full
yes,
screen, please?
sure, definitely.
Thank you.
And then this is the Prisma diagram that we created. Okay, so the records from PubMed 2019-2025, 169, from other databases, 293. The filter which we applied was for pediatric population. We excluded the systematic reviews and meta-analysis. Total title and abstract screening, the articles which we got were 462. 66 were duplicates, so we excluded those. We did full text screenings for 396 articles, out of which, because of no specific pediatric data, we excluded a lot of articles, like 387. And finally, in our study or in our review, the articles which were included were 9. So this is the thematic table of the 9 studies from which we extracted our data. And this basically, we have put it together as like the design of the study, some more randomized control trials, prospective and retrospective study, the country where this was done, these studies were done. It's kind of across, as you can see, USA as well as other parts of the world. Age range, we have set that criteria. So our age range is between 6 to 18. Biologics used, most of the category of the biologics which we used are there, except for benralizumab, which is not there, but that was because it was not specifically, we couldn't find the data. Sample size, as you can see, because it's pediatric population, it's a smaller sample size, except for one study where we have like 2,453 people. And what we saw in the study, we just reported the reduction either in hospitalizations or asthma exacerbations. The follow-up duration, we just put it down here, as well as safety findings if the study has reported it. So this is what we derived like a pie chart from those studies. As you can see, most of the studies that were included were omalizumab, which was the first approved drug like we spoke about, and then dupilumab, and then mepolizumab. When we talk about what we found, like how much it is decreasing the asthma exacerbations, or by how much percentage, we were not able to do that. So what we did is basically we said, okay, omalizumab decreased asthma exacerbations in 5 studies, decreased hospitalizations in 6 studies, decreased oral corticosteroid use in 6 studies, and decreased ER visits in emergency room visits in 3 studies. Similarly for dupilumab and mepolizumab. Um, this is some other areas where some of the studies concentrated, like improved lung function as well as increased biomarkers. Not all studies spoke about it, so we just basically put together which one is talking about it. So
Usha, your
omalizumab.
7 minutes are up.
Okay, this is my last slide. So
And
this is what we concluded. Biologics decrease asthma exacerbations, hospitalizations, decreased in ER visits while being considerably safe. And our limitation was having no quantitative data. These are some other projects I worked on during the 6 months, case report, which recently got published 2 days ago, narrative review, as well as social media project, which I've been working on. Any questions?
thank you so much, Usha. Just a little over the time, otherwise very good presentation. Dr. Bansal and Mesha to add feedback and questions, please. Starting with Dr. Bansal first.
Uh, I just want to ask you one thing, like because I helped you a lot for the refining the
Yes.
search and everything, and so I remember that in 2013 there is a guideline paper. So
Yes.
what we are going to are we agreeing with the guideline, or are we disagreeing with the guidelines published in 2019, or like what other significant finding you are observing after this thematic scoping review?
Yeah.
Could you
So
please
yeah,
highlight that?
yes, definitely. First of all, thank you, Dr. Bansal, for all your support and help throughout this time. And that's a great question. Basically, I think for whatever we have done for all of these studies, most of the studies are positive. We are agreeing with the guidelines to answer your question, because studies are showing that biologics have decreased asthma exacerbations and reported decreased ER visits, decreased oral corticosteroid use, even though we did not have like that quantifying data in most of the studies. But I think it is, we do agree with the guidelines.
Thank you.
Thank you, Dr. Usha. That was great presentations and very nice topic actually on omalizumab and other monoclonal antibodies. My question to you, just since I follow this project, the process of your project, and you had to switch from systematic review to
Yeah.
scoping review. So, what was the biggest challenge that you actually encountered during that switching of that from systematic review to
Yeah.
scoping?
So, yeah, thank you for asking that question. Basically, I think so. First, we wanted to do a systematic review. But, when the reason why we switched to scoping review was because most of the studies, even these 9 studies, are quantifying the data. But most of the studies are like, okay, we include pediatrics 12 and up, but when you look at their data, they only talk about adult data. There's no demarcation. Like, that is the biggest, and we were like, how are we going to derive data from a study which is mixed? So we had to exclude most of the studies. Challenging wise, I feel, because most of the systematic versus scoping review, both of them initially we go through the same things. So like we have to do that data search, we have to do Ryan, we have to do all of those things, and it's only at the end when you extract the data there is a little bit different. So I feel like it's kind of almost the same, even though only after doing it I realized that. So
Thank you. Thank you. Great presentation.
thank you.
Thank you so much, Usha. Any other questions from any other faculty? All right. Thank you so much, Usha.
Thank you.
Atif, you can go next whenever you're ready.
Yeah.
And let me know so I can start your timer on time.
Okay. All good?
Yes, now we can see it. Just
Okay.
starting your timer. Go for it.
Okay. Welcome everyone. My name's Atif. When I had first joined GRRSP, I was actually a student, and when towards the end of this amazing program, I ended up getting a position of an ML engineer at Hospital of Special Surgery. And my question throughout this program and before that was, I wanted to investigate the impact of hallucinations in AI healthcare communication, and I wanted to see how we could mitigate these using some standardized way of strategies. And so I wanted to develop a systematic review for that. Now, let me explain to you why this is important. First of all, there's a rapid adoption of AI in healthcare. It's being used almost everywhere, and its capabilities are pretty strong. And it can be used for summarizing text, understanding images in different image modalities, clinical reports, and there is a way to the use of AI can streamline workflows, improve automation, and reduce any dependence on human labor and personalize even patient communication. So I wanted to say what is hallucinations in AI systems, and that is loosely defined as something that could be plausible, could be factually correct, but in fact isn't. And again, it's very hard to define what hallucinations is as I went through this study, because almost every article that I have reviewed had a different way of defining it. And therefore, in my head, I knew that there was a need to have a standardized way to even define hallucinations to begin with. And even with that, the consequences of hallucinations is adverse. Like there could be patient safety risks if the AI model suggests that the person is fine based on their clinical report, and in reality they aren't. That could lead to misdiagnosis, inappropriate treatment even. And even with that, doctors would start being a little, start questioning the AI models and maybe not want to adopt it, even though it has so much capabilities. And there's also, again, a lot of ethical and regulatory questions and, questions about that. So the whole idea of hallucinations needs to be addressed, and there needs to be a way to solve it. And that's what I try to bring my point over. There needs to be a standardized way of measuring hallucinations in the different domains of AI that's been used. And my goal was to review again all articles that measure hallucinations and perform a systematic review to understand the most common hallucinations and strategies to mitigate them. Now, I'm sure it's a bit confusing again what hallucinations are, so I wanted to show a couple of examples. For example, in the top one, you can see it's just an input describing it's like a report of a patient. The LLM clearly mentions leg swelling when it was not at all mentioned in the clinical report. So that's an example of hallucination. It just makes up stuff in a way. And in the second example, in the bottom row, you can see we ask a simple question from the image, and it says the biggest organ is heart, but the lung is the biggest uh, image. So again, it just doesn't it's not able to interpret the image properly. So that was the examples of hallucination. So my whole process, I've created a Prisma chart for that. And I had looked through PubMed, Google Scholar for my articles. I found about 476. I removed 67 duplicate articles. I screened 409, and my reasons for exclusion were they did not meet my PICO criteria. There was no mention of hallucinations in the AI, like the AI models, and there were review case reports, and they were not relevant to healthcare. And then I had done full text retrieval on about 201 articles with at least 2 reviewers. And we tried different languages, non-specific outcomes, preprint, commentary, discussions, review articles, and again, not relevant to healthcare were all excluded. And finally, I ended up with just 51 articles to review. And so my whole idea was that I was going to use I wanted to have this taxonomy for hallucinations. And so I found this paper that clearly helps me define what the hallucinations are, or at least the different types of hallucinations. And my goal for now was, let me see if I can classify these hallucinations in all of these papers into any of these categories that I mentioned here. Now, there's a lot of categories here, some ranging from like factual hallucinations to memory-based hallucinations, that is what's in the memory of these AI models, to research hallucinations, where it says, does it make up citations and references to research that never existed? And some of them are like reasoning hallucinations. Like sometimes it gets to the right answer, yes, but how was its reasoning? Like, how did it come up with their answer? Is it flawed in that? And so these categories almost encompass the entire workflow of an AI model, and it makes sure that if it can capture the hallucinations in every aspect of the AI model. And so that's what I decided to do. And in my results, I was able to categorize all of these articles into these different types of hallucinations. Now, I obviously you can see the number of articles is more than 51. Well, that's because in each paper, different there were different number of hallucinations again. Uh, so that's why I had to put in multiple categories, like the same article. And obviously now you can see the most common ones were actually the non-factual hallucinations, where it seems like it's right, but it's actually not. And the other one I would see was factual hallucinations, where it generates incorrect factual information, like just straight up wrong information. And research hallucination is another one which is pretty common. Uh, Something that was surprised that I didn't see much of was decision-making hallucinations, and that's because I don't see that many AI model or many researchers looking into the decision-making aspect of the hallucinations, and so that was pretty surprising. But my goal was also again to look into these papers and see what are the most common ways to strategies or that they had addressed or maybe looked into to mitigate these hallucinations. And the most common was retrieval augmented generation, RAG. Essentially, it's basically connected to a database where it can in live, pull in data and make sure that it's correct. So it's always up to date with anything that's in recent. So it's not relying on any outdated data, which is again a big reason for the factual and non-factual hallucinations.
Arthur, your 7 minutes are up. Please wrap
Yeah.
it up.
Yeah, and so this is the final thing. Yeah, so and then also uncertainty quantification. We can add in these models some way to measure these uncertainties and quantify them. So that's one other way to strategy to mitigate hallucination. So yeah, all in all, I just want to say non-factual and factual hallucinations are the most common type of hallucinations that are observed. And again, these can cause adverse effects in healthcare if left unchecked. So there is a need for aggregating these hallucinations per domain and to see how we can, quantify them. And so then we can, and only then we can, address these with appropriate strategies. So yeah, thank you to all the mentors, all listed here, but also special thank you to Dr. Rahul Kashyap for introducing me to this program and the field of healthcare AI research. Thank you.
Thank you very much, Atif. That was a very nice presentation. Dr. Rahul and Dr. Faisal Nawaz for questions and feedback, please.
Right. Thank you, Atif. Overall, I really, liked your structure of presentation. I liked how you started off with actually explaining to the healthcare audience about hallucinations and not assuming that, your overall methodology was clear. I could understand the way you've run this project. You were confident enough to speak about what you've done, which to me is the biggest sign that, yes, you have done this research and this is not being presented in someone else's behalf. My question to you now, Atif, would be, clearly we can see there are certain types of hallucinations that have come up more than the others.
Yeah.
Has your research been able to identify the reason for why it seems that, for example, the non-factual one and the factual ones were more? So is there any plausible reason why AI tends to hallucinate more on those domains than others?
Yeah, so the reason why I found out one was they're using the older version of these models. So these models aren't up to date anyway. And so they perform poorly because of the data it's been trained on. And so that's why when I suggested a strategy to mitigate these was to use a RAG method where it constantly pulls in data, live data, so it's constantly updated. So that's the one reason. The biggest reason why was, again, yeah, it's on those very older poor models, and now these newer models are coming in. And the other reason I would say is that it still struggles with like multimodality. Suppose you given an image, you also given a report, and if there's like somewhat little bit conflicting or like a confusing information where a person of expert would probably notice it, the AI model isn't able to. So its multimodal capabilities is also quite not there yet. So I would say these are the two big reasons.
Thank you, Atif. Over to Dr. Kashyap.
Thanks. Atif, well done. My question is a little bit generic, saying, starting this journey of with GRSP with doing a systematic review on this topic, can you share with us, with your fellow graduates and others who are joining today, how your understanding has evolved to do a systematic review meta-analysis on this topic, any other topic for that matter, where you were and then where you are now? So can you share how your understanding and impression has evolved?
Yeah, absolutely. So if I'm getting it right, so you're asking me how I understand what a systematic review is. And yeah, so originally when I had begun, my idea of systematic review was just try to find a bunch of articles and try to find any common metric that they're all measuring. And you can perform some sort of statistical analysis on those and come up with a conclusion. But given my topic that I had used, it wasn't so straightforward because with hallucinations, again, like I said, there's different definitions of it, and there's different ways people were quantifying in different papers. And again, they were also defining it in a different way. So the challenge came in was, can you read all of these articles, figure out a way to aggregate the numbers, crunch up the numbers qualitatively or quantitatively, of course, and perform any kind of analysis on it and come up with a conclusion. And it's again, the whole process is again not so straightforward, because when I'm including, or even when I'm in the full text screening phase, right, there is a lot of articles that I had to exclude because they were brilliant papers, and they also mentioned hallucinations as well, but again they didn't quantify it as well, or they just like, oh, these were hallucinations, and we just we found these we found these results of the AI model to be hallucinations, and they didn't further clarify what does that mean. So the whole idea of systematic review is, can you like smartly read these papers and figure out where the actual I guess it's like the gold nuggets are, and piece them together. And so that's what I've been trying to do, data collection. And now my next steps of this project is, which of course I'm not going to finish it right here, is I have these data right now that I'm collecting, and now I want to aggregate them in a way that I can understand them per domain, per AI model, per AI task. And that's my goal next steps now. And yeah, that's what I would say.
Thank you.
Thank you so much, Atif. I have just one question to ask because
Yeah.
it's most relevant to you. You are not somebody who's a healthcare worker, right? You have
Yeah.
been working in hospitals in other capacities. So just wanted to ask, how has this experience been for you working with other healthcare professionals in a research capacity? Just
Oh,
a
yes.
brief overview of how you felt this was for you.
The main thing is that it keeps me grounded, because if someone asks me specific terms, you know, and I'm expected to know it, it does make me think. And obviously it keeps me grounded, and I know I should be prepared for every technical term that I spit out. I should know what it means, and I should be aware of the audience around me. And that's definitely helped me in my new position, because when I'm working in this hospital, I'm interacting with a lot of non-technical people, a lot of research assistants, research fellows, and they have a medical background and they have no idea what I'm saying, right? And because of this program, I've been able to, be grounded and explain in a way where even they get it and even they understand what my work is and how I can help them, how they can help me, and that improves collaboration. And if that's the one thing I would take away from this program, is it helps me be more grounded.
That's a very nice answer. Exactly why I wanted to ask that.
Yeah.
Thank you so much, Atif. All right, moving on to last but not the least presentation, which is going to be by Saket. Saket, whenever you're ready, please share your screen and I'll
Yes.
start it.
I share my screen. Is my screen visible to everyone yet?
Not yet.
Not yet.
Now we can see.
Okay. So, yeah, good morning. This is Dr. Saket Parsi. I'm working as hospitalist in Texas. My topic for today is effect of sodium glucose co-transporter 2 inhibitor on atrial fibrillation recurrences after ablation in atrial fibrillation patients. This is a systematic review and meta-analysis. So atrial fibrillation is the most common cardiac arrhythmia. It prevalence in US is expected to double between 2010 and 2030. It increases the risk of serious cardiovascular events such as stroke, heart failure, and cardiovascular deaths. So rhythm control and atrial fibrillation burden reduction are very important to lower this risk. So it can be achieved with ablation. It's more effective than antiarrhythmic drug therapy. But still, the scatter ablation success rate is between 50 to 70%. It depends on what type of atrial fibrillation and other comorbidities. So SGLT2 inhibitor shown to reduce this atrial fibrillation recurrences after ablation by improving metabolic and cardiac function or directly affecting on ion channels. So our objective is conduct a systematic review and meta-analysis to assess this SGLT inhibitor can reduce the recurrence of atrial fibrillation in patients who have already undergone the ablation. So we conducted a comprehensive search with the Boolean search criteria in PubMed, Scopus, and Web of Science and Cochrane. And we covered studies published up to February 2025. We screened title and abstract with inclusion and exclusion criteria. Our inclusion criteria is studies with participants aged 18 or older, who had a history of atrial fibrillation and undergone ablation and was treated with SGLT2 inhibitors during the ablation and had at least 1 year follow-up from ablation. And we excluded non-English studies, like other review articles, and studies with the participants under 18 years, and also studies which did not report the results. So the resulted studies had a full text screening. During full text screening, we included original research articles that reported at least one common clinical outcome. Our primary outcome is atrial fibrillation recurrence by the first follow-up in 12 to 24 months and by the final follow-up. And our secondary outcomes are atrial fibrillation recurrences by the interval follow-ups and change in left atrial diameter and multivariate atrial fibrillation recurrence risk. So we used a Raymond tool for statistical analysis and applied a random effect model to account for any heterogeneity across studies. And also we evaluated the risk of bias among the studies with two tools by two reviewers with a blind on. And the DROP2 tool was used for randomized control trials, and NIH risk of bias tool was used for retrospective cohort. This is the Prisma flowchart of our study selection. Among 4 different databases, we collected 270 records, 40 from PubMed, 38 from Web of Science, 168 from Scopus, and 24 from Cochrane. 64 duplicate studies were removed, and 206 studies undergone title and abstract screening. 193 were excluded after screening. And we got all full text, 13 full text articles. So we screened them. And out of those 13, 3 were poster presentation and 1 was original research, but did not met our outcome. There was no common outcome. So at last, we included 9 studies in our systematic review and meta-analysis. So out of those 9 studies, we included 2 were RCTs, randomized control trials, and 7 were retrospective. So total participants were 6,874. We found that SGLT2 inhibitor significantly reduced atrial fibrillation recurrence at first follow-up in 12 to 24 months by 42%, and by final follow-up, it was 38%. At interval follow-ups, by 6 months, it decreased 47%. By 12 months, there was 44% decrease in SGLT2 group inhibitor. And by 18 months, it was 45% decrease in SGLT2 inhibitor. But at 24 months, there was a 40% decrease, but it did not achieve a statistical significance. In contrary to the above results, 41% increase was seen in atrial fibrillation recurrence in SGLT2 inhibitors by 36 to 42 months. Importantly, there was a 56% decrease in multivariate risk of atrial fibrillation recurrence in SGLT2 inhibitor group, and also change in left atrial diameter improvement in SGLT2 inhibitor was seen in patients with a diameter more than 45 mm, but there was no significance in people who had a diameter less than 45 mm. These are the flow charts of our outcomes. For these all are like forest plots of AF for our outcomes. AF recurrence, atrial fibrillation recurrence by first follow-up in 12 to 24 months shows 42% decrease in SGLT2 inhibitor, and AF recurrence by final follow-up showed 38% decrease in SGLT2 inhibitor group. But in 24-month follow-up, you can see this diamond was crossing the midline. That means it was not clinically significant. But if you see 36 to 42-month follow-up flow chart, you see there was a 41% increase in atrial fibrillation risk in SGLT2 inhibitor.
Saket, your 7 minutes are up. Please wrap it up.
So yes, to conclude this, so SGLT2 inhibitors decreased AF recurrence especially within 12 to 18 months, and also this benefit remains even after adjusting for clinical confounders, suggesting potential independent productive effect. And also it decreased left atrial diameter in patients with diameter more than 45 mm. This tells us it plays an important role in remodeling of atria. Thank you.
Firdaus, would you like to go first, please?
Thank you, Dr. Zara. This is amazing to see, Saket. I think that's how you spell your name.
Yes.
Very interesting topic. I'm just trying to see where you earlier mentioned about how you were able to find the heterogeneity between the groups that you put into your data collection. So how did you actually come up with that, if you would want to elaborate more?
So first, we tried with a fixed model. It was showing 50% heterogeneity. So when there is a 50%, we usually use randomized control trial, if I'm not wrong. So that's what we came with. To avoid that heterogeneity, we did left out one research studies, and at last we came where heterogeneity was minimum to get those results. But still, there was no change in the results, no significant change. Yeah.
Great, that's amazing. And your results looked quite amazing as well. Looking forward to you taking this forward in terms of, publishing it soon.
Thank you.
Great work.
Saket, that was a very good presentation, very much in detail on a very technical topic. So I appreciate how you were very calm throughout the presentation. It didn't seem like things are confusing you. You know what you've done and you were able to explain it as well. And these are the best kinds of presentation always, because when somebody is looking at your project who doesn't know anything about it, they're able to understand it. So that's good. That being said, could you please summarize the main two findings of your study? Because you mentioned in your results slides they were around 6 or 7, but what were
Yes.
the main two results that are to be remembered out of your study?
So the important one is decreasing the AF recurrence at least by year or 18 months. And also change in the left atrial diameter, that's a good finding too, especially when it's more than 45 mm, because left atrial diameter or dilatation is the most common condition to cause atrial fibrillation, especially around circulating around the pulmonary vein. That is the most common thing causing atrial fibrillation. So if SGLT2 inhibitor is showing that improvement, then that's a good finding, because it can that shows that it can also decrease in other conditions, in other heart conditions where remodeling occurs, like MI or other. Yeah.
Thank you. That summarizes it. Thank you so much, Dr. Saket. Any questions from other faculty members?
So, Saket, what will be the possible explanation of your decreasing the LAD diameter from SGLT2?
So there are several mechanisms for that. First one, its indirect effects on RAS system, renin-angiotensin, aldosterone system. That one of the mechanism, and other is affecting the fibroblast or macrophages that increase the fibrosis of the cardiac muscle. So inhibiting those fibroblast or macrophages will decrease the remodeling of the heart and decrease the damage of the heart. So these, from my understanding, these two things are helping the SGLT2 inhibitors to improve the diameter of the left atrium.
Thank you so much, Saket. Any other questions? All right. So that brings us to the end of the presentation segment. We still don't have Anifa joining. Dr. Saket, can you please unshare your screen?
Oh, yes.
Thank you. I'd like to hand over the mic to Dr. Kashyap to introduce our guest speaker. Meanwhile, we make some important decisions in the background.
Absolutely. I think great job, everybody. GRRSP15 graduation. Every graduation we bring a GRSP alumni who has gone through the process, and then they were also the valedictorian for their graduation. So this time, we would like to bring Ms. Firdaus Osman. She is our GRSP 14 graduate. She GRSP alumni, and she had joined us as a faculty assistant as well in our ongoing GRSP 16 batch. So Firdaus, we'd like to invite you and share your thoughts about GRSP, your own journey, and any inspiration for this newly graduating batch of GRSP 15.
Thank you, Dr. Kashyap. It is amazing to be here. Hello, everyone. I am so grateful that I am, here in front of you, an alumni of GRSP batch 14. I want to start by saying that how this journey that you have taken in is not only going to sharpen your research skills, but you will really get to see that how you yourself are going to be a global scholar. And when I began my GRSP experience and with all of these mentors, like you all might be feeling today, I felt the same. And it was filled with curiosity, excitement, and obviously a bit of self-doubt as well. I come from a background as an oncology nurse, and I wasn't still passionate about patient care, but research felt more like a new world, new language to me, and getting in GRSP changed everything about that. And it taught me about research. It taught me about everything apart from research as well. And there were moments where I knew that asking questions would be very challenging, but it was something that always would lift me higher, and I would see that guidance coming from my mentors. And looking at how you all are graduating today, and you will soon realize that GRSP is more than a program. It is like a community. I feel at this place where mentors support you and the peers, inspire you. There are a lot of challenges as well throughout, but all of this really shapes you, and it has shaped me for who I am and where I am in research today. I also feel like for me, this journey turned into virtual connections, but not just virtual connections. It became like a real friendship with all of these mentors that you get to see and work with. And these ideas and these collaborations and this GRSP platform itself, brought a meaningful action in my life, which I'll be always grateful for. The batch 15, I would like to say that try to embrace every moment, ask, explore, and don't be afraid to um, come up with anything that you have. And we are always here, and GRSP team will always be there for you in every way throughout your guidance, through research, and a lot more what growth comes in your life. By the end, you'll be amazed to see how far you have come. I can already see the results, both as a researcher, but also as a person. GRSP really teaches you skills and puts you grounded as a person as well. So, congratulations on starting this chapter. You are not ending this chapter. I always tell people that, and can't wait to see you all make an impact. And I will all remember you as great scholars making impact throughout. Congratulations once again.
Thank you for those. Really appreciate it for sharing your insights there. And at this point, we would like to usually, when we ask our batch to nominate somebody from their own class, there's a split there. There is more than one person or same person. This time it was pretty unanimous, I believe. So the commencement speaker for graduating batch 15 is Dr. Saket Parsi, and he is prepared a speech for a few minutes, I think 2 to 3 minutes as well. So Dr. Saket, please do share your thoughts on behalf of your batch for GRSP 15.
Sure, sure. Thank you for giving me the opportunity to share. Yeah, I mean, I'm very happy today, honestly. When I started this research journey, I didn't know where to begin. I have no experience, no clue, and about what is research. And also, I looked at the published papers by others and like feel like how did these people like even get there? But from that point to now, where my own research is almost ready to be published. It feels like a huge journey for me, and it wouldn't be possible without the mentor support and the guidance I received every week. Um, Before starting this research journey, I have written my own manuscript with some research knowledge. Dr. Kashyap knows that. But with regular meetings, with changing, with the corrections and with discussions every day, yeah, it made to a where it was which was accepted without any rejections at the end. Initially, it was there were multiple rejections on paper, but at the end, it was accepted with no rejections. So that was something need to be shared in this meeting. Now I feel like okay, there might be a reason I failed at that time. It's okay, and that is a part of the journey. For that reason, I need to thank Dr. Kashyap. He was always been there, never judged us, never made us feel small for not knowing things. Instead, he patiently explained and corrected. You should see his expressions when we ask questions which are already answered. Uh, yeah, but they taught me how to think, how to like ask right questions, and more importantly, how to trust myself. I need to appreciate for giving me that confidence to me. Not like even Dr. Bansal, Dr. Faisal, always been there, gave me advices, how and honest feedbacks to correct my paper. So your mentorship like gave me a direction when I feel like I was stuck or confused, and also gave clarity about the problems I'm facing at every phase. And yeah, there was always helped me to move forward when I am like stuck at some topic. So I really happy to get these mentors, and also of course my amazing research group every week, Misha, Zara, Usha, Atif, Annie, and thank you so much. Without you guys, the journey would have been like I don't even imagine without you guys being there. We discussed many topics every weekend, and it was always an exponential growth. Every week was something I learned. It was never plateaued. It was always an exponential growth for me. Um, so it more than anything, this journey like taught me how to learn, how to keep going when things don't work, and how much we all grew when we have the right people beside us, like Dr. Kashyap, Dr. Faisal, and Dr. Bansal. So once again, I from bottom of my heart, thank you so much to my mentors and my peers, who like everyone whoever stood by me. I may have started from zero, but today I feel very confident giving this speech. Hopefully, I'm ready to take the next step. Thank you so much. Sorry. Uh, I mean, I I got close to these people, especially Usha. Whenever we, after the weekend, when we get stuck, we call each other and like, I'm got stuck. I don't know. Maybe my paper is not working. And we positively motivated each other to come to this level, actually. Oh God, you don't. We used to like take 1 hour every time after meeting. Did you understand? Did you get this? We explained each other. It was several days we discussed, am I going in a right direction or not? But when it come after the meeting, that all those things will be cleared by mentors. But before that, it will be like chaos in our minds. And Atif, I mean, obviously there's a different atmosphere between me and Atif, but still I enjoyed his conversations during meeting. Yeah, it was fun every time. Like Atif presentations and the way he speak and everything. So it was good actually.
All right. Thank you so much, Dr. Saket, for giving that speech. Now, I think, Zara, you want to take over?
Thank you. Yes, I'll just do this. Thank you so much, Saket, for just sort of summarizing the past few months for us. And as much as you all enjoyed the last 6 months, we did as well, because this was a very diverse group for us, even though you were only 4 people from different backgrounds and from different phases in your career. Somebody said something, sorry? All good. Okay. So with that, we come to the end of the ceremony almost, but we have some awards and certificates for you. And for that, I'd like to hand over the mic to Dr. Nawaz. And after that, we'll have a nice class photo, and then we can wrap it up. Over to you, Dr. Nawaz.
Thank you, everyone. And it's been amazing just looking at all the presentations today and how much you've perfected it. This is the work that's practice after practice. So well done. And then to hear from our alumni and then hearing from Dr. Saket. So it's a full round. So obviously we come to a part where it's about celebration, and that's where we have our presentations and our graduation certificates that we'll be giving out. So I'm going to share my screen and we'll be going through the certificates for everyone attending today. So just a second. To the certificate ceremony for GRRSP15 scholars who are now just a few moments away from becoming GRRSP alumni. We'll start off with the certificate for each scholar here, followed by maybe a few words on your side. So our first in line to graduate today is going to be Atif Abedin. Congratulations on graduating from GRRSP15. It has been an honor hearing you and working together on seeing your project come through. So congratulations, Atif. Our next in line is going to be Saket Parsi. Congratulations, Dr. Saket, on your graduation today from GRRSP Batch 15. You are now a GRRSP alumnus, and we're very proud of all the achievements you've done. Any words from your side, Dr. Saket? You've spoken a lot already, but anything on this moment of graduation? Can you hear us, Dr. Saket? I think you're on mute. We move on to the next in line for graduating today, and that's again not surprising. Last but not the least, Dr. Usha Ravi. Congratulations on graduating from GRRSP 15. We have seen a lot of amazing scholars over time, and you've been one of those stars for us. So well done on your project, and we need to continue this journey of research and take more milestones ahead from here on. So that is
congratulations, all of you.
Thank you.
Now we are going forward with a bonus, which is going to look at awards given off today as part of the GRRSP program. These are awards for really exceptional work and efforts you put in, and we highlighted some of these skills in during this time. This is an award that comes with no bias because all the faculty together decide on this. So moving forward with our first award, which is going to be for the best presentation from today. This award goes to Dr. Saket Parsi. Congratulations. Your presentation hit a
Thank
mark
you.
for GRRSP on all the points where you presented, structured. So well done, and I think
Thank
deserve
you.
it.
Thank you so much. I appreciate it. Thank you.
So that was our first award for the day, the best presentation. And we will now move forward with the next award, which is going to be for the most collaborative scholar in these 6 months with GRRSP. This really shows how much we value the work of collaboration that you do in your projects. And I think maybe you know who you are. So this award goes to Dr. Usha Ravi. Congratulations. You have come out as the most collaborative. That doesn't, bring anything less of how much the special day is in graduation. We really
Thank
think
you.
that you're going to go ahead and collaborate on even bigger projects with GRRSP. And lastly, we also have an award that is dedicated to the most rising scholar that has grown the sort of at the most promising pace in these 6 months. This award goes to Atif Abdi. Congratulations, Atif. You are the GRRSP Rising Scholar, and we hope you keep rising and achieving more and celebrate it with us as well.
Thank you.
Congratulations. So that actually concludes today's session with a very big congratulations to each of you. And we hope that you now becoming alumnus and alumni will continue representing GRRSP wherever you go around the world.
Thank you, everyone.
Thank you, everyone. This was amazing.
Thank you.
We can stop the music if possible. And yes, if the three of you guys can say any few words, please go ahead, and then we'll take a picture of you guys. Three of you have met the criteria to meet the graduation, to graduate it. You will be immediately added to the GRSP alumni group. That's the requirement for you to finish the projects in 6 months minimum, and then do the graduation presentation. So that'll happen automatically. No extra fees. Any words from you, Usha, Atif? I think Saket's spoken already.
Raising the hand as usual. All right. So first of all, I really wanted to say thank you to each one of you, the mentors, Dr. Kashyap, Dr. Bansal, Dr. Nawaz, Nisha, Zara, just everyone. Because I feel like it's not easy to mentor someone who's starting from scratch, who has no idea about systematic review or meta-analysis or what's scoping review and what's this and what is database and what is how to search. So yes, we all started from zero, and thank you for the patience, because I feel like multiple classes were just on the basics, owning those things repeatedly again and again, again. I really think I had multiple meetings with Dr. Kashyap just because of the search strategy, because it was like, oh my God, how do I even do this? How are people doing it? So thank you for being really patient. And knowing is one thing, and I feel mentoring is totally different. So you guys, each one in your own style, have mentored us, and I learned from something from each one of you. Whether it's Dr. Bansal, Dr. Nawaz, Dr. Kashyap, like each one has their own specific, big things which they are good at, and we learn from that. So thank you for the opportunity. And I feel this research program really helps with collaboration, like with all of the other people, especially from different walks of life. Like Atif, I still remember when we asked, okay, what is hallucination? Is it like the same hallucination that we think about as doctors? And so it was really nice to have all those different background, different people from around the world. It was an eye opener for me personally. So thank you for the opportunity, and I look forward for more projects with you guys.
Yeah. Same sentiment, but even more for me is that, yeah, obviously I didn't know all of these type of reviews and again the basics, amazing mentorship for that. But also, this program was able to take in someone who's not from a medical background and more from a technical background, and uh, I'm so happy. Like I was able to understand, and like you were able to guide me, all of you, and and like I think I always think back to the day when I met Dr. Kashyap in the summit in the conference, and I just knew I had to just speak to him. Like there were so many other people, so many other technical people, but I just knew I had to approach Dr. Kashyap, and because of that decision I made that day, I was able to meet the gemstone of this program and all of you people. Dr. Faizan Nawaz, thank you so much for giving me resources and guiding me throughout. And Nisha, of course, she's been helping me throughout with the project, and like I really appreciate all of you guys for the support and the mentorship. And it's again, like I said, I was smiling again. Yeah, I was smiling way too much during this because it was feeling surreal. I'm not lying when I say this is much better than the graduation I had a month ago for my college. So this was my more personalized. It felt much better, even though this is online. But yeah, definitely it's yeah, I was smiling again, like I said, because it's a bittersweet. I more so bitter because I didn't want this to end. Obviously, this is something I could look forward to every Sunday morning, and something I could work on, which is not related to my work or college. So yeah, again, hopefully we can all stay in touch. Usha, Sakib, Annie, Nisha, everyone. You know, we all are gonna collaborate. Hopefully, in more future projects. So yes, thank you, everyone. Thank you so much for this.
That's
Absolutely. I mean, something that I look back to in the last 6 months is just how much it wasn't just about you learning and absorbing from us, but we actually got to learn a lot of things from you in the background to a point where it would motivate us to actually be here. And sometimes you would have more faculty than scholars, and that just shows how much we look forward to those Sundays. So that gap for the Sunday is going to be a tough one to not have in the coming days with this group. But that only means that you join us in other hours, other projects. So we have now that you're part of the alumni group, which you'll be added to very soon. That means access to certain office hours, more opportunities, maybe even meeting in person. So I look forward to or in-person visits. Now it only keeps getting bigger. This is not the end. This is the beginning. So all the best again, and we'll be in touch for sure. I'll hand it over to Misha so she can speak a bit about her experiences.
I think Dr. Nawaz pretty much has said everything. And yeah, this is actually really personal to me as well. Like we have like 3 scholars who graduated, and I'm very much happy with the results. And yeah, I mean, we can see that Atif could not stop smiling, and we can see that he was too happy that it actually radiates to all of us here. So I'm just really happy actually to see you guys, Dr. Sakib, Dr. Usha, and Atif, and just really great result. Thank you.
Great. Now over to Dr. Zara.
Thank you, Faisal. So, very similar comments to what Misha just said. It's nice to see all of you are smiling at the end because eventually what matters is how much you learned and are you able to take that growth on yourself well as well. And we can see that for sure. It's very interesting that when you started off, we had these times where we all discussed it as faculties that we'll need to push certain things because people are not getting it. But now that you've graduated, you had excellent presentations, all of you, with projects that you knew what you did on and what exactly has to be told to another person about. Nothing more matters than this milestone for you all. Now, this is only one presentation, but you know the confidence that you have gained from this 6 months and by presenting today in front of 6 faculty members who have done this over and over again. So this is sort of a small mini conference for you. The next time you go on a conference and somebody tells you that, your time is over, you will not freak out as much. So these small things will always count as the experience that you should have in research world to make you a more confident researcher. And you have that today. So that would be my closing comments on it.
Great. Thank you, Dr. Zara. Over to Dr. Bansal, who has helped a lot from the meta-analysis and the systematic review side of things. And absolutely excited to hear from you, Dr. Bansal.
Thank you, Dr. Faisal. And I congratulate all of you, especially Saket and Usha, and I hope I am able to mentor them from like what I know from for the systematic review, meta-analysis, and I hope that you will also understand what is systematic review and scoping review. And I hope this will help you to refine your PICO and your future research or something like that in that one. I did not closely work with Atif, but I like his idea for hallucination, and I heard the first time that hallucination exists in AI world. That is, I am not aware about that one because of you, and that's how I know more about hallucination, why AI and everything. Thank you. I learned a lot from you as well, Atif. Thank you.
Right. And then, of course, Dr. Kashyap, a few words from you before we hand it over to Misha.
Absolutely. Thank you so much. I think I said it enough, but every graduating batch is such a pride for us that you started wherever you started, and hoping that with the help of the faculty members, we were able to contribute to the journey, the cause you guys joined this program. This is, you're already added to the alumni group now, which is, are almost closing to 75 strong alumni in last 4 or 5 years for that matter. This work doesn't end. Many of you, as you continue to work on your goals, would help you be faster in your goals as you go through. We hope that you take the integrity, the honesty, the hard work, and then collaborative nature out of this program, and then deploy that into your other projects. Continue to do some research. Some of you may not, but whatever you learn from it, it will come handy to you if you keep those skills alive. It can become part of your life, your professional life, your personal life as you go through as well. So we are very excited that the three of you got graduated today. And then I think I'll bring it to Misha for closing remarks. And then we'll take a group photo.
Yep, so we're at the end of our graduation, everyone. The kind of graduation that supposedly better than Atif's graduation. He said it. So this is very personal to all of us here, to all the mentors. And yeah, everyone, just a few last words from me just to keep the momentum, keep pushing, keep grinding every day, and let's aim for that publications. And I'm looking forward to see your abstracts actually being presented at the conference, like international conferences. Like that's the aim for GRRSP here. So yeah, let's take the last picture. Let's take a last photo before we sign up.
Misha.